and it comes back to normal. Okay, so that is the meaning of reversible. Yeah. If it is irreversible, then neurotoxicity will persist. Generally, if you see, the diabetic patients will have nephropathy. Okay, so that continues whether the patient is on the treatment or without the treatment, but patient's nephrotoxicity will continue. Sorry, neurotoxicity will continue, or peripheral neuropathy will continue. Okay,
Okay.
that's the difference. Yeah.
Clear.
Okay. So I hope it is clear to everyone what is reversible and or irreversible, right?
Yeah, they said it is clear.
Yeah, okay. Thank you. So now we will come to another side effects of this platinum compound is ototoxicity. So can anyone tell me what is ototoxicity? Have you ever heard about this terminology ototoxicity? It is related to
Toxicity
which
related
part?
related to ear, I think so.
Yes,
Related
very
to,
good.
yes, correct,
Very
correct.
good, very good, very good.
It is related to hearing, right? So these side effects basically it is hearing loss. If the some patients if they're taking the platinum compounds, might be they will get hearing loss. So ototoxicity is another side effects of platinum compounds. So here there is a you can there is a no ototoxicity you can find in oxaloplatin. Yes, there is a no severe side effects in carboplatin. Yes, but there is a more severe you can find in cisplatin. Right. So in cisplatin you can find there is a severe and irreversible ototoxicity. Right. So
That
yeah,
means
not
it will become permanent. With
permanent.
cisplatin, ototoxicity can become permanent. So patients can lose hearing or the power of hearing can decrease. So there can be loss of hearing with cisplatin, which will be permanent. Okay.
Yes. So now come to the another nausea and vomiting is in general in the chemotherapy patients, but there is a less percentage you can see in oxaliplatin, the 30% in nausea vomiting in oxaliplatin, then 60% in the carboplatin, and more than 90% in cisplatin. So you can from make it out there's like the oxaliplatin is the most safer drug than the cisplatin. Right. So the dose limiting toxicity. Yes, there is a neurological dose limiting toxicity here in oxaliplatin, then myelosuppression that you can see in carboplatin, and nephrotoxicity in cisplatin. So other side effects like laryngopharyngeal spasm and cold dysthesias. So these are the side effects of other platinum compounds. Alopecia and visual and seizure in arrhythmias in cisplatin. Right. So this is we have seen the side effects, right?
Right, right.
Okay, so now come to the recommended dosage for oxaliplatin for the patient who for colorectal cancer, right? So it is oxaliplatin in combination with fluorouracil and leucovorin every 2 weeks. It is given always combination with a fluorouracil and leucovorin. So for the patient for the adjuvant treatment basically the patients have undergone the surgery. After that the surgery the patient continue the treatment with oxaliplatin for up to 12 cycles or till the patients have seen any toxicity will occur. So for advanced colorectal cancer, there is a continued treatment until disease progression or unacceptable toxicity. So what will the dosage on day one for oxaliplatin? You can see the oxaliplatin given 85 mg per meter square as an intravenous infusion over 120 minutes and leucovorin 200 mg per meter square as an intravenous infusion over 120 minutes at the same time. But these two products can be given in a separate bags, right? And also if there is a followed by fluorouracil 400 mg per meter square as an intravenous bolus. So there is a difference between infusion and bolus. It has been given by bolus venous, right? It is like whole drug is giving in a 2 to 4 minutes, right? It is a very fast process. And followed by fluorouracil, then again they are giving fluorouracil 600 mg per meter square as a 22-hour continuous infusion. Like they have given fluorouracil, but after 22 hours again they will administer the fluorouracil. So these are the day one regimen for the colorectal cancer. And if you come for the day two, again they are administer the leucovorin 200 mg per meter square as an intravenous infusion over 120 minutes. Then followed by fluorouracil as intravenous bolus for 2 to 4 minutes. Then again they are giving the fluorouracil, but after 22 hours, right? 22 hours continuous infusion. So here in the second day they are not administering the oxaliplatin, but they are continuing with the leucovorin and fluorouracil. See, this is a dosing we have seen. Then, if we, as I have already said, the oxaliplatin is safer to cisplatin. Why? Because we have seen there is a severe toxicity in oxaliplatin compared to severe toxicity in cisplatin compared to oxaliplatin. There is 100% with cisplatin, and in case the women are more sensitive to this toxicity. And if you see here, the cumulative cisplatin dose for cisplatin is 300 to 500 mg per meter square. This is for toxicities to occur. So it is very tiring for patients, the high doses they are taking. And toxicities may be irreversible because they are permanent. So this with cisplatin, so they might have lose their some like ototoxicity, they might have lose their hearing loss, right? In neurotoxicity also. So symptoms last perhaps indefinitely, or it might be lifelong. So in case of oxaliplatin, we can see the most patients have nearly full recovery within 6 months after discontinuation therapy. Like what they have said, if the patient has found their toxicity with oxaliplatin, they can be recovered within 6 months. But in case of cisplatin, that might be the lifelong. The toxicity will be lifelong, irreversible. So that is why it said the oxaliplatin is a safer than cisplatin. So the what will be the contraindications? Now come to the contraindications. It is a hypersensitivity to the drug or any component of the formulation. It is severe renal impairment in this neutropenia, then thrombocytopenia, then peripheral sensory neuropathy, and pregnancy and lactation. So these are the contraindications for the platinum compounds. Then come to the warning and precautions, like oxaliplatin should not be administered directly into the vein. Do not mix with another drug. And any reconstituted solution showing signs of precipitation must be destroyed. If any something like after the reconstitutions, if the something can be precipitate can be found in the product, so that has to be destroyed, right? So the complete CBC have to be checked frequently. So how the reconstitutions done for the oxaliplatin? It is done with the water for injections or 5% glucose solutions. So oxaliplatin 50 mg, add 10 to 20 ml of solvent to obtain a concentration of 2.5 mg to 5 mg per ml of oxaliplatin. Whereas for the 100 mg oxaliplatin, there has to be so dilute with the 20 to 40 ml of solvent to obtain a concentration of 2.5 to 5 mg per ml. Right, and after the solution can be stored for up to 24 to 48 hours in the original vial at the temperature of 2 degrees Celsius to 8 degrees Celsius. So the dilution for infusion, like the reconstituted solution in diluted with 250 ml to 500 ml for 5% glucose solution and administered by intravenous infusion, right? And these preparations for infusion can be stored for up to 24 hours at room temperature. So this is a presentation of our Xalipet. It is a Xalipet 50, which is 25 ml vial containing 50 mg of oxaliplatin, and Xalipet 100 as a coming 50 ml of vial containing 100 mg of oxaliplatin. Right? The storage should be stored below 30 degrees Celsius and protect from light. Do not freeze. So these are all the protocol regimens. Like I would like to highlight only the main regimens of the colorectal cancer for oxaliplatin. The first one is capox. Capox is the combination of capecitabine and OX is the oxaliplatin. So you can see on day one they are giving oxaliplatin 120 mg per meter square IV over 2 hours, and whereas capecitabine they has given orally twice daily. It is comes in a orally form, right? 1000 mg per meter square, and the cycle should be repeated for 3 weeks for 8 cycle. And whereas if you can see the regimen for the oxaliplatin, fall is basically the for here it is the fluorouracil, and for folinic acid is also known as leucovorin, right? So fall is also known as leucovorin or folinic acid, and whereas F is fluorouracil and OX is oxaliplatin. So see, oxaliplatin it is given 85 mg per meter square IV intravenous over 2 hours with leucovorin in a separate bags. They are giving 400 mg per meter square IV over 2 hours. Then followed by fluorouracil 400 mg. That is intravenous bolus, like on push for 2 to 4 minutes, as we have seen in our dosage presentation. So this is a basic the most common regimen for the colorectal cancer, capox and fallpox. So there is also other regimens, so we can go through it when we'll send the slides to you all, right?
Can anyone tell me, have you all come across any of the protocols where oxaliplatin is being used? You all are promoting oxaliplatin, right?
Sorry.
Dushala, all of them are promoting oxaliplatin.
Not all of them.
Some of them are new.
Only one of them are represented for KLAB company.
And remaining?
The remaining on other companies like derma companies, ophthalmic products.
But now after the
So
training, they will be promoting on KLAB products.
yeah.
Okay. So till now, they have not promoted oncology products or KLAB products.
Yeah. They
Okay.
will promote.
So
Except
who's the person? Who's the person who was promoting oxaliplatin or KLAB
Rosa,
oncology range?
Rosa,
Oh, that's
Rosa.
why. That's
That
why
is why
Rosa is
Rosa,
able to
Rosa is
answer.
always.
Oh,
I'm giving
very good,
answer.
very good. Rosa, please come ahead. Please come ahead.
You are on demand now.
Okay, she's
Yes.
telling.
Oh, that's why she's so vocal and she's answering to all the questions.
I'm coming.
Hello, Mr. FT.
Hi, Rosa. Asha, see, Rosa, you have already promoted oxaliplatin, right? In Ethiopia.
Yes.
Okay. So have you come across any protocol where oxaliplatin is being used?
Uh, doctors use the recommended dose that you
Huh.
guys use.
No, that's correct. Recommended dose is correct. Have you come across any protocol like Folfox 4, Folfox 6, Kepox, or Zelox? Any such name have you come across?
I guess have come up with the cold fox.
So that means Folfox is commonly used. See, especially
Yes.
where the patients cannot afford, and actually the basic protocol for colorectal cancer is Folfox. So first, either doctor use Folfox 4 or Folfox 6. Then after that, your Capox and Zelox have come, where oxaliplatin is combined with capecitabine. Okay, so Folfox is a basic protocol which is still widely used, and nearly 6 to 8 cycles of Folfox 4 or Folfox 6 are generally recommended for colorectal cancer patients. Okay, so I'm sure you have seen Folfox being used in your working, right? So now
Yes.
when you see doctors are using Folfox, please check whether they're using Folfox 4, Folfox 6, or they are combining Folfox 4 and Folfox 6 with capecitabine or with trastuzumab or with any other drug also. Okay, so keep that in mind. Then immediately you will understand, okay, if it is Folfox, then oxaliplatin can also be used. And there I can promote my KLAB's Xalipat as a brand. Okay. So that's why you need to know which protocols doctors are using. So always when you go and meet the doctors, not only for Rosa, for all the others, please check which protocols doctors are using. Then it will be easier for you to promote your brand. Yeah.
Yes.
Okay. Good. Thank you, Rosa.
Okay. Thank you, Mr. FT.
So I hope this brand is clear for everyone. Oxaliplatin.
Yes, it's clear.
Yes. Okay. So we will see another brand which is also having the same indications, colorectal cancer, right?
Okay.
Okay.
Yeah. Yeah. So as I was talking about the another brand, so having the same indication, the brand name is Irinod. I hope this brand is you are promoting everyone. Yes, Rosa.
Only
Yes,
Rosa. Only Rosa.
Only Rosa. Yeah, only
Only
Rosa.
Rosa.
So Irinod,
yes.
you know
It's the
indication
same.
about Irinod, Rosa? It is promoted in colorectal cancer.
Yes.
Yes. Okay. Okay. So now the same questions I will ask everyone. So can anyone tell me this comes under which chemotherapy classification? And yes,
They said it inhibit topoisomer 1 inhibit. And it inhibit topoisomer
Yes,
1.
Very
correct.
good,
It
very
is
good,
it
very
is a
good.
topoisomerase 1 inhibitor, right?
Yeah.
Okay, okay. Wait a minute. Yeah. So it is a topoisomerase 1 inhibitor. Okay. So also it is a topoisomerase 1 inhibitor derived from the camptothecin. It is a derivative of a camptothecin, right? So as you can see here, the colon anatomy we have seen already in our oxaliplatin presentation. So yeah, it is irinotecan was the first introduced in the Japan by the pharmaceutical arm of Yokult Honsa as a Camto, and it is in 1994 it has received a FDA approval in the United States, where it is now marketed by Pfizer in camptothecin as camptothecin. So irinotecan is a chemotherapy agent, as you rightly said. It is a topoisomerase 1 inhibitor. So chemically, it is a semi-synthetic analog of natural alkaloid called camptothecin. It is derived from the Camptotheca acuminata plant. It is a Chinese plant. From there, it has been derived, and they made the semi-synthetic analog of a camptothecin, irinotecan, right? So it belongs to a class of plant alkaloids, which are used as a chemotherapeutic agents. So can anyone tell me topoisomerase 1 inhibitor cuts single strand of DNA or double strand DNA?
Single-stranded DNA.
Yes, single strand of DNA. It's got single strand of DNA. So now we will see the mode of action for irinotecan. So if you see, irinotecan is a prodrug, right? So once it is going inside the body, it will become active. So to become active, there is an enzyme which is help to make this active compounds. The carboxyl esterase is an enzyme which make this compound activate, and the compound become active metabolite is SN38. This is a potent inhibitor of topoisomerase 1 inhibitor, and also it is also getting inactivated in the liver from with the help by the glucuronidation. Glucuronidation is a process which making the uh, biliary action, that is the something has to be excreted from the body. There is a something the chemical substance in your body that has to be excreted, so it will get inactivated by the process called glucuronidation with the help of uridine diphosphate glucuronyl transferase. Okay, so it is become SN38G. So that is how it is become inactivated. So SN38 is the active metabolite of the irinotecan, and this is the potent inhibitor of topoisomerase 1. Right. So this is how the inhibition of topoisomerase 1 by the active metabolite SN38, and that eventually leads to the inhibition of both DNA replication and transcriptions. Right. So irinotecan prevents the ligation of the DNA strand by binding to a topoisomerase 1 DNA complex. So what will happen? There is a cell cycle arrest will happen. So if there is a the irinotecan will inhibit the topoisomerase 1, there is a no replication will happen, and eventually the cell will death. Now come to the indication. As you know, the indications for the irinotecan is a colorectal cancer. As a component of a first line therapy, it is given in a combination with a 5-fluorouracil and leucovorin. Also we have seen in oxaliplatin, also they have given in a combination with a 5-fluorouracil and leucovorin. Here in the same case, they are also giving in a combination with 5-fluorouracil and leucovorin for the patients with metastatic carcinoma of the colon and rectum. Also for patient with metastatic carcinoma of the colon or rectum whose disease has reoccurred, recurred or progressed following initial fluorouracil based therapy. So what are the dosage for the irinotecan? As a single agent regimen, irinotecan 125 mg per meter square intravenous infusion over 90 minutes on days 1, 8, 15, 22, then 2 weeks rest. Right. Then after that, as a single agent, also given as a 350 mg per meter square intravenous infusion over 90 minutes on day 1 every 3 weeks. So another regimen for with combinations, we have seen the single agent as a monotherapy it is given 125 mg and 350 mg, but as a combination we'll see here irinotecan 125 mg per meter square intravenous infusion over 90 minutes on days 1, 8, 15, 22, and with leucovorin they are giving 20 mg per meter square intravenous bolus infusion on day 1, 8, 15, 22. followed by 5-fluorouracil. That is also given intravenous bolus infusion on day 1, 8, 15, 22 every 6 weeks. And another combination regimen you have see here, it is given here 180 mg per meter square irinotecan intravenous infusion over 90 minutes on days 1, 15, 29, and then with leucovorin they are given 200 mg here giving 1 mg per meter square intravenous infusion over 2 hours on days 1 to 15, 16, 29, 30, and followed by 5-fluorouracil that is given 400 mg per meter square, that is intravenous bolus infusion, right, on these days. And also they are giving followed by 5-fluorouracil 600 mg per meter square, that is intravenous infusion over 22 hours on these days 1 to 15, 16, and 29. So you can go through it this once again, this combination regimens, so that it will you will remember. So this is again irinotecan, the same combination agent, dosage regimens and dose modification, right? This given if the this Camtosar is a irinotecan, it is a research brand of irinotecan Camtosar, then leucovorin and 5-fluorouracil. Again here the recommended dose modification for combination use. Here it is a toxicity you can see here, the neutropenia, right, and the diarrhea. So diarrhea is the most common toxicity in irinotecan. Then what are the precautions should be taken with the irinotecan? The patient should return to pre-treatment bowel infection without requiring anti-diarrhea medications for at least 24 hours before the next chemotherapy administration. Right, the new cycle therapy should not be begin until the granulocyte count of the patient should come to the normal level and the platelet count also should recover. Right, so then after that the new cycle should continue, and the treatment should be delayed 1 to 2 weeks or to allow for recovery. So here also they are talking about if the patient has to be recovered from their uh, blood counts and the neutrophils and these platelet counts, so that they can start their new cycle. So now if the patient has not recovered after a 2-week delay, the consideration should be given to discontinuing irinotecan. If the patient has not recovered from their recovery phase from the neutrophils and the platelet counts, the irinotecan should be discontinued. Then what are the pre-medication should be taken, like the dexamethasone, then antiemetics like ondansetron and granisetron. Then antiemetic agents should be given on the day of treatment, like starting at least 30 minutes before the administration of irinotecan. So before the administration of irinotecan, the antiemetic should be taken before 30 minutes. Then physician should also consider providing patients with an antiemetic regimen for subsequent use as needed, right? And prophylactic or therapeutic administration of atropine should be considered in patient experiencing cholinergic symptoms. So these are the pre-medications you have to be like patient need to be take before the administration of irinotecan. Again there is a regimen for weekly versus 3-weekly regimen for irinotecan, regimen 1, right? So again protocol, the Zeloxary. Zeloxary is a regimen protocol for the colorectal cancer. Here irinotecan, oxaliplatin is also known as Zeloda. So the brand name, the research brand is Zeloda. So that is why I have taken here Zeloxa for oxaliplatin, and OX is oxaliplatin, and I is irinotecan and capecitabine, right? So irinotecan, oxaliplatin, and capecitabine for Zeloxary regimen. So they are here. They have given 165 mg per meter square over 1 hour on day 1, and oxaliplatin they have given 85 mg per meter square over 2 hour on day 1, and capecitabine they have given 2500 mg per meter square from day 1 to day 7, and repeat every 2 weeks. So there is another regimen is Irox, irinotecan, and oxaliplatin. Right. So here the dosage is 85 mg per meter square, followed by irinotecan 200 mg per meter square over 30 to 90 minutes every 3 weeks. The same regimens for again there's a folfiri plus cetuximab, folfiri here the folinic acid or leucovorin, IF is fluorouracil, and irinotecan, right? The same irinotecan 180 mg per meter square IV over 30 to 90 minutes on day 1, then leucovorin 400 mg per meter square IV infusion, Then to match the duration of irinotecan infusion on day 1, then 5-fluorouracil 400 mg per meter square IV bolus on day 1. Then 1200 mg per meter square on day 2. To total, there is a 2400 mg meter square over 46 to 8 hours. So that means the 5-fluorouracil should be given on a 2 days, like 2400 mg per meter square, and is a continuous infusion. So another regimen is there: folfiri plus cetuximab, folfiri plus panitumab, folfiri plus bevacizumab, and folfiri plus ramucirumab. Oh, sorry. So you all can go through these regimens. Okay, so I'm not going into all these details. So why Irinot? It forms the integral part of the first line therapy in metastatic colorectal cancer, and it increases survival rate. Right, these are the benefits. And according to the Health Canada, irinotecan is being recognized as the first new post-surgery therapy for colon cancer since 5-fluorouracil. Like after the adjuvant therapy, irinotecan is the best choice for the physicians. It helps in avoiding a medical complication of the disease. Then this, as you know, the target audience is medical oncologist, surgical oncologist, radical oncologist who practice chemotherapy. The composition, if you can see here, each 5 ml contains irinotecan hydrochloride trihydrate 20 mg. Then administered, as you know, it is given intravenous infusion over 90 minutes, and it has to be stored below 30 degrees Celsius and protect from the light. So these are the pack. This comes in 40 mg per 2 ml and 100 mg per 5 ml. So in a nutshell, if you can see here, basically the irinotecan is a topoisomerase inhibitor, and it is mainly integrated for the colorectal cancer, right? And these are the main indications, right? I hope it is clear for everyone. For the regimens
Yes,
and all,
it's
you
Yes,
can
clear.
yes.
go through it once again when we will send you the slides in details. Okay.
Okay, 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 doctor.
See, for
The
protocols,
Rosa,
you will see for
Mr. Shiva.
protocol, you will have to go again and again through the slides and the material which we keep sending. Okay, only then you will get familiarized with all these protocols, because there are multiple protocols. So even if you take it here, you will not remember all of them. Okay, so when we
Correct.
send you the material, please go through them again and again and correlate what your doctor is using, what your doctor is using. Then you will start remembering. Okay.
Okay.
Ms. Dipiti,
Yes.
Rosa have one question for you,
Yeah.
so she can forward.
Hello, Mr. Deputy. I have one question.
Yeah.
And in our country, for treating colorectal cancer, our medical oncologists use the one protocol in which you say the folfiri plus bevacizumab. And
Yes.
I wonder if the pharmaceutical produces Licoborin.
Then you said which protocol? Folfox
Folfiri
Iris.
plus cetuximab, I think. Right?
Folferi with bevacizumab?
Bevacizumab.
Folferi with bevacizumab. Yes.
Yes,
So what are you asking?
they. So I wonder if the KLAB pharmaceutical produces Licoborin.
See, the thing is, we have oxaliplatin, we have irinotecan, we also have calcium leucovorin. We make for some of the companies, but I think you all are not taking our calcium leucovorin. Okay, so you can
So
check
the
with
KLAB.
Osama. We do make calcium leucovorin. You can check with Osama and Bedrick. If they want, they can contact our export manager, Mr. Abhay Verma, for calcium leucovorin. Okay.
Okay.
Yeah.
So now come to our next brand. Actitop.
You want me to take now? You want a break, Shiva?
Uh, no, I
I'll
can
finish
take.
it.
No, I can take. Not an issue. I will take. I will take.
Okay.
If you want, you can in between. If you want to explain anything, so
Okay. Okay. No problem. No.
yeah, yeah. So right now, team, we have seen the last brand irinotecan, which is comes under topoisomerase 1 inhibitor. Okay, so now this is the brand Actitop etoposide, which is comes under which classification?
Topoisomerase 2 inhibitor.
Yeah, topoisomerase 2 inhibitor, correct? So we have seen the topoisomerase 1 inhibitor, their mode of actions, and it is indicated in which indications? Wait a minute, yeah. Hello. Sorry, it's a company call. Sorry. Yeah. So we will going to see now the Actotop etoposide, which is
Actitop.
Actitop. I'm so sorry for the pronunciation, team.
Because in
Actitop
India we promote it as Elastate. The
Lastate,
original
yeah.
brand is Lastate. So we promote with the brand name Lastate, and for exports our brand name is Actitop.
Actitop. So in India we are having a brand name as ma'am rightly said, Lastate.
But I had only given the name Actitop for
Yeah,
exports. And of course for domestic for that matter.
yeah, yeah. So here Actitop etoposide, the topoisomerase 2 inhibitor, which cuts the double strand of DNA. Okay, so it is a semi-synthetic derivative of photophytotoxins, which is derived from the mayapple tree. Okay, so used in the treatment of certain neoplastic disease. Mainly, it is if you can see, it is a comes in injectable, is a topoisomerase 2 inhibitor, which inhibits the DNA synthesis, and it is mainly acting on the G2 phase of the cell cycle. Right. So as you all know, the mode of actions for the topoisomerase 2, it is cuts the double strand of the DNA. So mainly the indication for the Lastate is small cell lung cancer, acute leukemia, bladder cancer, malignant lymphoma, testicular tumors, and trophoblastic disease. What do you mean by trophoblastic disease? Ma'am, yesterday ma'am have said this, explained this. In anyone? Yesterday we have discussed on trophoblastic disease.
It's trophoblastic tumor.
Yeah, trophoblastic tumor. And anyone remember?
Where does it originate?
I guess it's inside the uterus.
Yeah, it's inside the uterus at
You
the placenta. At the placenta. When the
placenta.
placenta joins the uterus, at that place.
Yeah. It is formed during the abnormal pregnancies. So that time it is formed these tumors, trophoblastic tumors, right? So malignant lymphoma, testicular tumors, and Lastate. So these are the indications for the etoposide. Again, the capsules, it is recommended in a small cell lung cancer and testicular cancer, and is specifically designed these capsules for chemotherapy naive patients and elderly patients. As you know, it is very outpatients, right, for etoposide capsule.
Can anyone tell me what is chemotherapy naive patients?
Yeah.
What do you mean by chemotherapy naive patients? Rosella? Rosa? Rosa? What do you mean by chemotherapy naive? What do you mean? Why there is so much of disturbance, Rosa,
Yeah,
there? Why people are moving and coming out? Why there is so much of disturbance? Yeah. People are going and coming in.
There was a distraction in the projector, so they were fixing the projector.
Oh,
okay. You should have stopped me
Fine.
in between. I would have stopped.
You could have
Yeah,
told us. Yeah.
yeah. Now it is
Okay.
everything has set. Your projector and everything all set.
Yes,
Okay.
yes, it's being
Okay.
setting.
It's
Okay,
taking
still
time.
setting. Still setting. Okay. Just let us know once you're done.
We'll
You
wait
can
till the
continue.
time it is. We can continue.
Yes.
Okay. So, Rosa, Shiva, your slides are not visible.
Yeah. Wait.
Yeah. So, Rosa,
We
have
were
you come
talking.
across this word chemotherapy naive patient? No? No? Can anyone? Can anyone think what do you mean by chemotherapy naive patients? Okay,
Chemotherapy
so these are
patients.
patients who have not taken chemotherapy, naive, who have not taken chemotherapy or who are new to chemotherapy. Okay, so these are the patients who are coming for the first time for chemotherapy. They might have taken some other treatment. It could be surgery, or it could be some hormonal treatment, or it could be radiations. But for chemotherapy, they are coming for the first time. Okay, so these are chemotherapy naive patients. Yeah.
Yeah.
Yes.
Rosa, I think still you all are not settled.
Yeah. We can hear the noises.
Yes, the processor is working, but the speaker is not being settled.
So we'll wait for a few minutes.
Yeah. Just you set
Can
everything, then let us know.
you wait 2 minutes? Can you give us please?
Yeah.
Yeah. Okay.
ግን ማለት ነው ቻርጅ አለው መሰለኝ 82% አለ። ስለዚህ እስከዛ ይሄኛው
ስለዚህ እንሰካው እንኳን እንደዚህ ይሽን ቀን ነው ቃል ገልብጦስ አማቻ ያረግ
ምኑ ላይ ነው? እዛ ላይ ነበር ማለት ነው ሲያዞር ሰርቷል። በቃ ስፒከሩ ከዛ ጋር ነው የተሰካው። የተሸ ሰክቶ ነበር።
ስለዚህ አንታስ ሰካው እንደዚህ
ሰራ እንዳይጠፋበት ነው ኔትወርክ ስላለ እንደዛ ይሰራ ነበር ያኔ። Deputy.
We can start.
Yes, we can start.
Okay. Good.
Okay.
Shiva, you can put up your slides.
Yeah.
Proceed.
Yeah. So now everyone has clear now what is chemotherapy naive patients, the patients who have not undergone for chemotherapy, right?
Yes.
So come to these etoposide injections. It is mainly recommended for the indication is testicular cancer, right? The usual dose in combination with other approved chemotherapy agents ranges from 50 to 100 mg per meter square per day for 5 consecutive days. So it is given 50 to 100 mg per meter square or 100 to 125 mg per meter square on days 1, 3, and 5 is also commonly used for testicular cancer. The chemotherapy courses are repeated 3 to 4 weeks intervals after the adequate recovery from any toxicity, right? So another indication is for small cell lung cancer. The dosage is in combination with approved chemotherapy drugs, which it is ranges from 35 mg per meter square per day for 4 days, or 50 mg per meter square per day IV over 5 minutes. That's 3.5 hours for 5 days. So for the dosage for the refractory testicular tumors, there's a 50 to 100 mg per meter square per day that has to be administered intravenously over 5 minutes to 3.5 hours on day 1 through 5, or 100 mg per meter square administered intravenously over 5 minutes to 3.5 hours on days 1, 3, and 5. And for the doses for small cell lung cancer, it is recommended is 35 mg per meter square per day. That has to be administered over 5 minutes to 3.5 hours for 4 days, or 50 mg per meter square per day administered intravenously over 5 minutes to 3.5 hours for 5 days. So these are the dosage for small cell lung cancer and the refractory testicular tumors. So what will the dosage for the oral capsules for etoposide? It is recommended 100 to 200 mg per meter square daily for 5 days. Or the daily dose greater than 200 mg should be given divided in BID. If the patient has taken more than 200 mg, it has to be divided in twice a daily BID. Then this is the regimens for small cell lung cancer. The protocol for small cell lung cancer oral etoposide. That means capsules they are taking. So cisplatin is recommended 100 mg per meter square intravenous on day 1. And here the etoposide 120 mg per meter square IV on day 1, and 250 mg per meter square orally day 2 and 3. So IV they are taking 120 mg and oral etoposide they are taking 250 mg per 240 mg per meter square on day 2 and day 3. So on day 1 they are taking etoposide injections. On day 2 they are taking oral etoposide. So every 4 weeks, maximum of 6 cycle. So this is again the capsules for extensive, that is for small cell lung cancer. Apatinib 250 mg per day. Then etoposide capsules they are recommending 50 mg per day on day 1 to 21. There is a 28-day cycle, and the treatment continued until disease progression. So again, this is the regimen for maintenance treatment. So what do you mean by maintenance treatment, maintenance therapy? Anyone? What is maintenance therapy?
Maintenance therapy.
We have seen this in our first class.
Maintenance therapy is a therapy given after medication, first medication or original medication is given. Then we give maintenance therapy to prevent the relapse.
Yes, to prevent relapse, and it has to be given after which? After what? After
Major therapy. After major therapy.
after the first
after
line. After the first line treatment.
first line treatment.
Yes.
First line
After
treatment
first line
means
therapy.
the chemotherapy that you're given first in the metastatic stage. That is first line treatment. Okay.
Yes.
Yeah. So maintenance therapy, as you rightly said, it has to be given after the first line therapy and to prevent the relapse, right? Or between the second line therapy. So all patients here the etoposide capsules as a maintenance therapy they are given for a small cell lung cancer. So they are recommended all patients receive 6 cycle of etoposide plus platinum based compound. So they have given etoposide capsule once a day for 20 days, and it is a 28-day cycle. It should be continued until the disease progress. And the stage 1 for dose 25 mg, and stage 2 there is a dose is 25 to or 50 mg they are recommended. Then the dosage for testicular cancer, here it is recommended 70 mg per meter square orally once a daily on day 1 to 4. It is in combination with approved the chemotherapeutic agents every 3 to 4 weeks. And alternatively, they administered etoposide 100 mg per meter square orally once daily on days 1 to 5 in combination. Then again, this is the regimens for Kaposi sarcomas, right? So you all can go through all the regimens. Then composition, come to the compositions of etoposide. What is the compositions? It is a Actitop 50. Each capsule contains 50 mg of etoposide, that is pack of 8 capsules. And here the Actitop 100. Each capsule contains 100 mg of etoposide. It is comes in a pack of 4 capsules. Right? And whereas the injection, it is a 1 vial, 100 mg per vial, 100 mg per 5 ml in 1 vial. So what is the preparations? It has to be reconstituted with the sterile water for injection in with 5% dextrose solution or the 0.9% sodium chloride, right? Or with also you can reconstitute with bacteriostatic water for injection with benzyl alcohol or bacteriostatic sodium chloride for injection with benzyl alcohol. So here if there's a vial strength is 100 mg, if you are diluting with 5 ml, the final concentration should be 20 mg per ml. Or if you're diluting with 10 ml, then final concentration should come 10 mg per ml. So here the etoposide can further dilute to concentration as 0.1 mg per ml with 5% dextrose injections or 0.9% sodium chloride injection. And inspect parenteral drug products visually for a particular matter and discoloration prior to administration whenever solution and container permit. So these are the preparations for the etoposide injection. So the it has to be stored below 30 degrees Celsius and protect from light. These are the packing for capsules, 8 capsules, and for the packing of 4 capsules, 100 mg, 50 mg, and the injections 100 mg per 5 ml. It is for IV use only. So in a nutshell, we can see here the etoposide comes under the topoisomerase 2 inhibitors and has a various indications like the testicular cancer, right? You have seen, and also the indications like small cell lung cancer, acute leukemia, malignant lymphoma, and bladder cancers. And also we have seen the dosage for all the indications. So I hope it is clear, this brand, everyone.
Yes, it's clear.
Main thing you have to remember, it is acting on which phase of cell cycle, and it is a what is the mode of action for this, and that's all. Everything you will job it done. And indication and dosage you can go through your regimens. We will send the slides.
Okay.
Okay, so shall you proceed for next brand?
Can we proceed to the next brand?
Or you want to
Yes, we
you
can.
have any doubts any in these products, etoposide?
No, we have no any doubt. We can proceed.
Okay, okay.
Rosa,
Yes.
we just have 2 products remaining. So should we continue and then you all can break for lunch?
No, we can proceed.
We'll proceed, right? Okay.
Yes.
Okay. Thank you. Thank you. Proceed. Shiva.
Okay, okay.
How many products are we left?
Only 2.
Only 2. This is the second
So
last brand.
we can finish it. Let's
Yeah.
proceed.
Okay.
Okay.
Thank you.
So you
Thank
can
you.
delay your lunch, I think, right?
Yeah. Start.
Yeah. Yes. Team, please attention. Kindly attention here. Yeah. So come to the next brand, bleomycin sulfate. Okay. Again, the same question I will ask to everyone. What questions? It comes under which chemotherapy class? What? Anyone remember?
We have done this on the first day. This comes under which class or which chemotherapeutic
They're
drug?
answering,
Yeah.
they're answering the question. They're answering the question and they said antibiotics.
Very
Sorry.
good. Very good. Very anti-tumor antibiotics. Very
Oh,
good.
anti-tumor. Correct.
Very
So I
good.
hope
Very
you have
good.
remember. So it is
Good.
a
Good.
comes under anti-tumor antibiotic, but here we have seen also there's anthracycline drugs also comes under anti-tumor antibiotics, but they are a cell cycle non-specific. But here in case both with bleomycin, it is a cell cycle specific. It is acting on a G2 phase of cell cycle, right? So you have to remember
Yeah.
this.
Yes.
So we will see bleomycin, the mode of action. So bleomycin basically having a binding site. One is having a DNA binding site and the iron binding site, right? So what they are forming the complex with the DNA binding site, and they are capable enough to produce the free radicals. So free radicals we have seen it is a here they are making the binding with the free radicals, oxygen free radicals. So the free radicals capable enough to damage the DNA strand. So that is how these free radicals damage the DNA strand and cleave the DNA strand. And what will happen if the DNA strands are broken? If there is a no replication will happen, the transcription is not happening. Ultimately, the cell cycle will die. The cell will die. Okay, so that is how the mode of action is the bleomycin. It works. It is forming the complex with the DNA and with iron binding site and DNA binding site, and generating the free radicals and cleave the DNA strands. It is very simple mode of actions. So bleomycin is also bone marrow sparing, that is affecting the less bone marrow, and may be used when another cytotoxic agents are contraindicated. So bleomycin is known to cause single and a lesser extent double strand breaks in DNA. As we have seen, it is a breaking the double strand of DNA. In vivo in vitro, it has seen that bleomycin is shown to cause cell cycle arrest in the G2 phase and in mitosis. That is why it is called, it is cell cycle specific. It is acting on a G2 phase of cell cycle. And when administered into pleural cavity in the treatment of malignant pleural infusion, bleomycin act as a sclerosing agent. So what do you mean by sclerosing agent? Basically, it is preventing the forming of fluid in the pleural infusion. Pleural infusion means there is a space between the chest wall and the lung. So that there is a space where the fluid is building up in the lung. So that is why here the bleomycin is acting as a sclerosing agent. So it is preventing the fluid to form in this space, pleural space. So I will just show you the photos of the pleural infusions. You will understand better. See, you can see here the images.
No, we
See
not
this?
yet.
No, not yet.
We
Yes.
can't. We can't.
Now you all can see.
No.
Okay, might be some lagging issue from your side. Okay. Wait, I will come to my slide only. So you all can see my slide.
Not yet.
Not yet.
Yes.
I think there is some network issue there.
Yeah. So try to log in and log out, Rosa.
Yes, we
Can
can
you
see.
do
We
that?
can see the slide
Now.
now.
You can see. You can see now slide.
Yeah,
Yes.
yeah. You can
Yeah.
start.
Okay. So basically what I'm talking about here, the bleomycin is acting as a sclerosing agent in the pleural space. So pleural is basically the space between your lung and chest cavity. In this space, the fluid are building up. The abnormal fluid are building up. So what bleomycin is doing, it is preventing the fluid. It is preventing the fluid should not build in that space. Right. So that is here the bleomycin is acting as a sclerosing agent. So now we will see the indication. It is recommended for the squamous cell carcinoma, that is head and neck cancer, which includes in this mouth, tongue, tonsils, nasopharynx, oropharynx, sinus, right? This and also the indications we have here. the lymphomas, Hodgkin disease, and non-Hodgkin disease. So, what is the difference between Hodgkin's and non-Hodgkin disease? Which cells are present in the Hodgkin disease? Yeah. Hello. Can anyone tell me? Hodgkin and non-Hodgkin lymphoma. What is the difference between Hodgkin and non-Hodgkin lymphoma? Yeah, I will tell you. In Hodgkin lymphoma, there is a Reed-Sternberg cells which are present. So that is what is known as Hodgkin's lymphoma. And whereas in non-Hodgkin's lymphoma, the Reed-Sternberg cells are absent. Right. So from you can make a difference. In Hodgkin's lymphoma, the Reed-Sternberg cells are present. Okay, it is a cancer of a lymphatic system, lymphoma. So again, there's a recommended in indication for testicular cancer carcinoma, then malignant pleural infusion. As I was talking about the pleural infusion, it is a space between your lungs and chest cavity where the fluid are built in that space. Okay, so in that case, as a
Basically, if you have to understand what is malignant pleural effusion, lung is covered with two layers or is protected with two layers, which are called the pleura. Okay, so lung, to protect the lung, it has got two outer coverings. They are called as pleura of lung. So between the two pleural layers, there is a space. Okay, so when malignant cells or cancerous cells come in the pleura or the space between the two pleura, which is called as the pleural space, then the condition is called as malignant pleural effusion. So lung is surrounded by two layers which are called as pleura. So there is space between the two pleura which is hollow. If malignant
correct.
cells fill or if cancerous cells fill in this space, then that condition is called as malignant pleural effusion. And bleomycin is used to remove the malignant cells which are present inside the pleural cavity. Okay, so that is what you mean by malignant pleural effusion, and this is how bleomycin helps. Yeah.
Yeah. Yeah. So another indication, advanced Hodgkin disease and other lymphomas is indicated. So the dosage of bleomycin is intravenous, intramuscular, 10 to 20 units per meter square twice a week. So the side effects of bleomycin is the most serious complication of bleomycin is pulmonary fibrosis and impaired lung function. These are the most serious side effects. And it has been suggested that bleomycin includes the sensitivity to the oxygen toxicity. Right, it's very sensitive to oxygen toxicity. And other side effects include the fever, rash, hyperpigmentation, alopecia, and Raynaud's phenomenon. So again, there's a regimens for Hodgkin's lymphoma, ABVD regimen. It is what is AA is a adramycin. It is also known as a doxorubicin. Then B is for bleomycin, V stands for vinblastine, and D stands for dacarbazine. Right. So these are the regimens for Hodgkin's lymphoma. So where the doxorubicin is given to 25 mg per meter square on days 1 and 15. Bleomycin is given 10 mg per meter square on days 1 and 15, and vinblastine is given 6 mg per meter square on days 1 and 15, and dacarbazine 375 mg per meter square on days 1 and 15. So the malignant pleural infusion, so it is intrapleural 60 units as a single instillation, mix in a 50 to 100 ml of normal saline, right? So installation, basically the liquid is given, the whatever the normal saline is mixed with this 50 to 100 ml. In those cases, the liquid is given drop by drop in intrapleural ways. So these are all the regimens. For all the regimens, you will get all the details in our slides. So I'm just giving you gist of all the regimens for Hodgkin's lymphoma. There is a Stanford V regimen. There is again Hodgkin's lymphoma. They have regimens have Biocop regimen. Then Kaposi sarcoma, the regimen is ABV regimen. Then non-Hodgkin's lymphoma, there is a BOP regimen. Testicular cancer, there is a BEP or PEB regimen. Then testicular cancer advanced disease, PBV regimen is there. Then germ cell tumors, the regimen is BEP and PEB regimen. Then squamous cell carcinoma of neck, penis and cervix and vulva, and there is a BMV regimen, and same as for BOP regimen. So these are all the regimens. You will get in our slides all the details of this regimen with the dosage. So the composition and storage, each vial of Bleon contains bleomycin sulfate 15 units, right? And the storage has to be stored below 30 degrees Celsius. How the dilution has been done? So the bleomycin injection may be given by intramuscular, intravenous, or subcutaneous routes. This can be given by three ways: intramuscular, intravenous, or subcutaneous routes. It's reconstituted with the 5 ml sterile water for injection or 0.9% sodium chloride injection, right? Where the intravenous injection should be administered slowly over a period of 10 minutes. These are the Bleon pack 15 units dosage and administration. 5 ml sterile water for injection, right? Is there any doubt in bleomycin?
No,
You have understood
they
the
don't.
mode of action. It is acting on the
No, they
G2
don't have
phase cycle and forming the free radicals which cleavage the DNA strands, right? It is acting on the squamous cell carcinoma, lymphomas, testicular cancer, malignant pleural infusion. Is it clear the pleural infusion? It is a space between the lung and chest cavity, right?
Yes.
Right.
Okay. So for regimens, you can go through your slide, go through the slides once again. Any doubt in any of the four brands? Oxaliplatin, irinotecan, etoposide, bleomycin, so we can clear it, or otherwise we can proceed with next brand.
No, we have no any doubt.
Good. So we will be sending you with the material.
Yeah,
You can go through it, and still, if you feel if there's any doubt, Rosa, you can coordinate with Kimia, and you all can
yeah.
come back, right? Now,
So
one
we
more
will,
brand is remaining, so I'll take that. Yeah. So I'll share my slides now.
yeah, we'll stop sharing.
Yeah. So now basically we are left with one product, that is Vistin, which is nothing but Vincristin. I hope all of you can see my slides.
Yes, we can see.
Okay. So we had seen this. Vincristin belongs to which class of drugs?
Mythic inhibitor.
Correct.
Okay. Very good. And basically they are derived from which type of plants?
Being alkaloid.
Very good, very good, very good. So we come to that. So if you've understood that, then you've understood the product. That's good. So basically it's a plant alkaloid derived from vinca trees, which are also called as periwinkle plant. You can see the image of this plant. This is a very common plant which is seen very freely in India. I don't know in and Ethiopia also you can see these type of trees or plants.
We can't see
Yes.
your slide.
Oh, Shiva, you are able to see
stuck
my
on the,
slides?
Yeah, yes,
it's
yes,
stuck
I
on the
can see.
page.
Oh, you will have to refresh. Rosa, please refresh your network or the place where or your teams, whatever you're seeing in.
Or you can log in and log out.
Mm.
Log out and log in, sorry. Log out. और बेटर हो सकता था ना मैडम मेरा प्रेजेंटेशन.
नहीं,
can now see the slides.
Hello.
Hello, Miss.
Just,
Mr. Shiva.
just 1 second, 1 second, 1 second.
Yeah.
You can see my slides, Rosa?
Yes, we can see the slides, Miss.
Okay.
Miss Dipti.
You can see my slides, I can see you. I can see all of you all now. Good. Okay. So we come to the last product of our training session, that is Vistin. As you have correctly seen, it is vincristine, and as Rosa has said, it belongs to Wilca alkaloid, and basically they are derived from periwinkle plant. Okay, and the short form of this molecule is VCR. So very often doctors write it as VCR, or in some of the protocols it will be mentioned as VCR. So that's a short abbreviation of vincristine. Okay. So as we already know, this is a chemotherapeutic agent. It's a plant alkaloid, and the other plant alkaloids are your vinblastine, vinorelbin, and this is cell cycle specific, as rightly said by Rosa. Yeah. Now, did I mention anywhere here? Correct. Now, what is the mechanism of action? Basically, it is antimicrotubule agent. That means it has got antimitotic property. And by now, all of you know what do you mean by antimitotic property. It acts on the M phase. It does not allow the mitotic spindles to form, which are required to pull the genetic matter to two sides of the daughter cell. So basically, it does not allow the polymerization of the tubules, right? So polymerization is basically the formation of the tubules, and the tubules will become long and long so that they reach the genetic matter, right? But when vincristine is given, the tubulin formulation or the tubulin polymerization will not take place. If the tubules do not form, then obviously the genetic matter cannot be pulled to two sides of the cell, and because of which the mitosis cannot take place. If mitosis cannot take place, then obviously DNA synthesis cannot take place. Sorry, if mitosis does not occur, then obviously two daughter cells will not be formed. If two daughter cells are not formed, then cell multiplication stops. Okay, so if cell multiplication stops, that is what we want. We don't want the cancer cells to multiply. So this is how they will arrest the growth of the cancer cells. So in this diagram, if you see, you will understand what is normal mitosis. This is happening in the M phase of the cell cycle. You have 5 phases. In the metaphase, what happens is you can see the chromosomes, the genetic matter is present here. And basically, these mitotic spindles are getting formed. So basically, polymerization is taking place. Now, after polymerization takes place, what will happen? These spindles will be formed. These are long thread-like structures which you can see, which are attached to the chromosomes. Okay, so they are formed. When they are formed, they are taking away these chromosomes to one side, that is to the North Pole, and the others to the next side, which is the South Pole, right? If the genetic matter is pulled, then after this, there will be a split in between, and then two daughter cells will be formed. So this is a simple normal mitosis procedure which happens. But if a patient is given vincristine, what will happen? Here you can see the genetic matter, the chromosomes are present, right? But since polymerization of these tubulins is not taking place in the presence of alkaloids like vincristine, then the polymerization is not taking place. Okay, so these mitotic spindles just remain like small particles. If these spindles are not formed, then obviously genetic matter cannot be pulled to two sides because the spindle formation will not be there. Who will take away this genetic matter? They will lie wherever they are, right? So if this is not done, then obviously cell mitosis will not take place and new daughter cells will not be formed. So there is dissolution of the mitotic spindles, which leads to cell death. See, because if the mitotic spindles are only not getting formed, then obviously this original cell will also die and further cell multiplication is also stopped. So this is how the simple Vinca alkaloids function, which we have already seen, right? Yeah. Now coming to the most important part, where is vincristine being used? So there are multiple indications of vincristine. It can be used for adults and it can be used for children. For adult, it is being used for acute lymphocytic leukemia. Yesterday we had seen ALL. It's a type of leukemia. Which type of leukemia? Which is acute in nature. That means it develops suddenly. Which cells are involved? The lymphoid cells are involved. Therefore, the name is acute lymphocytic leukemia. Vincristine is approved in that indication. Vincristine is also approved for neuroblastoma. Neuroblastoma is a cancer which is found in the adrenal glands. Adrenal glands are found on the top of the kidneys. So if there is cancer in the adrenal glands, and this is called as neuroblastoma. Wilms tumor is a type of kidney cancer. Okay, so by mistake it has come here. Wilms tumor is actually a kidney cancer for children. Okay, when kidney can, one second, I'll just make that correction here. So for adults, you have an indication ALL, you have neuroblastoma. In lymphomas, you have Hodgkin's lymphoma, where it can be used, and it is also used for rhabdomyosarcoma. What is rhabdomyosarcoma? Like I had told you yesterday, when cancer is seen in the soft tissues of a human body, then it is characterized as rhabdomyosarcoma. Then you have Ewing's sarcoma. What is Ewing's sarcoma? When sarcoma is seen in the long bones, like the legs and the pelvis bone, then it is characterized as Ewing's sarcoma. Then in the pediatric indications, it is also used for ALL, that is acute lymphoblastic leukemia, for neuroblastoma, Wilms tumor. What do you mean by Wilms tumor? Wilms tumor is a type of kidney cancer which is seen in children. When kidney cancer is seen in children, it is named as Wilms tumor. So it is used for children in kidney cancers. It is also used for Hodgkin's lymphoma and non-Hodgkin's lymphoma in pediatric cases. And again, for rhabdomyosarcoma, it is being used. Sorry, there was, this was here. And have tried to pull this, then this is gone. Sorry, when I tried pulling the slides, some of the words went up and down. Okay, so in adults and in pediatric cases, more or less the indications are same. You have Hodgkin's lymphoma, non-Hodgkin's lymphoma, rhabdomyosarcoma, you have ALL, you have neuroblastoma. Okay, but in adults it can be used for Ewing sarcoma, and in pediatric patients it can also be used for Wilms tumor, which is a type of kidney cancer. So if you see, vincristine has got multiple indication. It has got solid tumor indications also, plus it has got leukemia and lymphoma. That means hematological related cancers or malignancies also. Okay, so this is such a product that it can be used by medical oncologist and also by your hemato-oncologist. Now coming to the dosage part of vincristine. Vincristine, as we saw, it can be used for children and it can be used for adults. For children who are weighing less than 10 kg, the starting dose should be 0.05 milligram per kg. It is not per meter square because children whose weight is less than 10 kg, there you cannot calculate on body surface area. So what you do if the patient's weight is say 5 kg, then 0.05 into 5. So that makes it 0.25 milligram. So that 0.25 milligram will be given to the patient who has got or the child who has got 5 kg weight. So here it is body surface area is not calculated on the basis of the weight. The calculation of the dose is done for children who are weighing less than 10 kg. For children who are weighing more than 10 kg, the dose is 1.5 to 2 milligram per meter square. Now, whose weight is more, 10 kg and above, then it has to be calculated on the basis of the body surface area of the child. So, it will be 1.5 or 2 milligram multiplied by the body surface area of the patient or the child. Now, the adult doses, the usual adult dose of vincristine is 1.4 milligram per meter square. So 1.4 into the body surface area of the patient. But if a patient is suffering, if the patient's bilirubin counts are high, that means if the bilirubin counts are above 3 milligram per 100 ml, then 50% reduction of the dose has to be done. So this is the dose limiting factor of vincristine. That means if the patient is suffering from some liver toxicity, only then the patient's bilirubin counts will be high. And when it is high, if it is 3 milligram and above, then 50% reduction of vincristine dose is required. So that is a dose limiting factor of vincristine. Yeah. Now these are some of the protocols. There are multiple protocols of vincristine because it's a product which can be used for multiple indications. So here I have not given you the complete regimens. When I made you the slides, I will give you the complete regimen. What do you mean by complete regimen? The actual dose of each of the molecule. So there are multiple protocols like the COPP protocol, that is called COPP protocol, where you have cyclophosphamide along with vincristine. C stands for cyclophosphamide here. O here stands for vincristine. P here stands for procarbazine, and the other P stands for prednisolone. One of the most widely used protocol for Hodgkin's and non-Hodgkin's lymphoma is CHOP, where you have cyclophosphamide, doxorubicin, vincristine, and prednisolone. Okay, so these are the some of the most commonly used and widely used protocols which you all should know. Now, if you see, say for example, this protocol, CMFVP, vincristine is there, that is Arvistin. We have doxorubicin, which is doxorubin, right? So these two products are there with us. In CMFVP, you have methotrexate, we have with the name Mthex. Then we have 5-fluorouracil, but it is not there in Ethiopia. So we have the next product, that is vincristine with the brand name Vistin. Now in CVB protocol, you have all the three products. C stands for cisplatin. You have Platinex. You all are promoting Platinex of Khandelwal?
Yes.
Yeah.
Sorry. Sorry.
Are you promoting Platinex of Khandelwal? Rosa? Do you promote cisplatin? Do you promote cisplatin of Khandelwal? Platinex? Cisplatin
Yes.
molecule of Khandelwal.
Yes.
What is the brand name? What is the name of the product? Khandelwal cisplatin. Have you heard of Platinex, Rosa?
No, currently we don't have cisplatin.
That is what. So here in Ethiopia, you are not promoting Khandelwal's cisplatin, right?
Yes.
Okay. So in the CVB protocol, you have cisplatin of you don't have cisplatin, you have vincristine of Khandelwal, and you have bleomycin of Khandelwal, right? Now, here VDC only vincristine, and in MOP, of course, only vincristine. So these are some of the most commonly used protocols. Once you know if a doctor is writing CHOP protocol, you can immediately make out, okay, that means he's using cyclophosphamide with doxorubicin, with vincristine and prednisolone. So I can promote two of my products, that is doxorubin and Vistin. If the doctor is writing COPP protocol, then I can promote my Vistin. If doctor is writing CMF VP protocol, then I can promote my methotrexate and I can promote my Vistin, that is Vincristine. So if you know the protocols, it will be easier for you to position the product and promote it accordingly. So we'll give you all the details and you can go through them and learn all the protocols and accordingly then start promoting your products, right? Now, coming to some of the side effects associated with vincristine, the most common side effect with vincristine is peripheral neuropathy. As I explained you, what is peripheral neuropathy? Patients start feeling numbness and tingling at the tips of the fingers, okay, which is quite similar to diabetic neuropathy only. Patients cannot hold their pen, patients cannot use needles, cannot use a knife, cannot hold the scissors. So they have lot of discomfort in the day-to-day activities, right? GI irritation is also seen with vincristine, alopecia, which is of course a very common side effect of the aggressive chemotherapeutic drugs, that is loss of hair. Myelosuppression is rare and mild. That means myelosuppression is rare and mild means bone marrow depression, where the RBCs or WBC or platelets count can go down, is might be seen, but it is very rare. And if it is seen, then it is very mild, which can be easily managed, and patients do not have to be disturbed with the dosing, right? Patients can have breathing problems or lung spasms shortly after the drug is administered. So immediately after the drug is administered, patients might have some breathing problems, but that is a temporary phase, right? So how is the administration of vincristine? It has to be given intravenously. It's the IV route. Administration time is just 1 minute. Okay. So this is a product which can be given very quick and fast. Preparation, it has to be diluted with 0.9% sodium chloride injection. It is stable after dilution for 24 hours. And when protected from light, it can be stored for 24 hours. And if it is kept under normal light, then it can be kept for 8 hours. What is the packaging? Each ml contains vincristine 1 milligram, and this vial is of 1 ml. That means it has got 1 mg in 1 ml. That is the concentration of the drug, plus the actual ingredient is also 1 milligram, because the pack is of 1 ml. This product has to be stored in cold chain between 2 to 8 degrees Celsius. Okay. You should not freeze the product, only maintain the cold chain, protect it from light, and for protection, we have given the product in amber colored bottles. You can see the brown, dark brown color bottle. So this is amber color to protect it from light. Okay. So this is how your Vistin pack looks. It's blue in color and the dose is 1 mg per ml. And it has to be kept at 2 to 8 degrees Celsius. So a cold chain has to be maintained. So this is all that you have to know about Vistin, which is your vincristine. The usage is huge. It is an antimitotic agent, basically acting on M phase. It has got multiple adult indications, multiple pediatric indications, can be used for both types of lymphomas, for acute lymphocytic leukemia, for rhabdomyosarcoma, for neuroblastoma. And in adults, it can be used for Ewing sarcoma. For children, it can also be used for Wilms tumor, right? The dose is for adults 1.4 milligram per meter square. For children lesser than 10 kg, it is 0.05 milligram per kg. Otherwise, for them, the dose is between 1.5 to 2 milligram per meter square. So that is all you need to know about Vistin. But when we give you the slides, please go through the protocols. Then only you will get familiarized, and accordingly you can place your product. So I hope this product is clear for you.
Yes, it's very clear, Miss Epti.
Any queries, any doubts? So, Rosa, these are the only products that you promote, right? We have not missed anything.
No, you didn't miss anything. You have covered all the products.
Okay, okay, okay. That's good. Rosa, you were there for the earlier training which I had taken last time in 2021. In the year 2021, I had taken a training program. So you were there?
Miss Epti, I come back.
Oh, Kimia, you were there. Back.
Yes. She didn't take this training before.
Who was there
But,
that time?
Sorry?
Who was there that time?
The rest, the 5% that I attached with the emails, the Fozia Tashala is here, Yerus is
But
there.
then, Kimia, if they were there, what they told me, only Rosa is promoting the KLAB brand. That they are not promoting the KLAB brands. Why like that?
Not only Rosa, we are just, yeah, we also have regional promoters like three regions, not only 4 regions are here. They are also here. And
Oh,
and we have a new plan. Maybe Osama will share you. That's why we all of us are taking this training together.
okay.
We have
So
a new
wait.
plan,
Okay,
being more
okay.
attention for KLAB products. That's why we need all products training for all of us.
Okay, good. So that means now all of them will be promoting KLAB products.
Of course, for the past 2 months, like that, Rosa, we assign only Rosa because, as you know, in the middle, we just pause for some discussion with the Badreg team.
No, what did you do?
And if you remember, there was something to discuss with the supplier in the Badreg.
Oh, okay, okay. Okay, 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 okay.
We will maybe we will discuss with Osama later. Yeah.
No problem, no problem, no problem. Okay, good. So now the thing is, since all of them are going to be promoting, it's good. So you can check with them if they have any queries. They can, of course, ask.
Sorry.
If anyone has got any queries, they can ask. We will be sharing all the balance slides. I had shared some of the slides on the first day. Okay, so today I will share all the balance slides. So all of them can go through it. Still, if you all have any queries or any doubts, then Kimia, you can coordinate and we can clarify, right?
Yeah.
Yeah.
Sure. So we are very, very happy to have such a wonderful training because I didn't take also this training before, so it was very detailed and very excellent training that we had a good time for both of you guys give us a yeah, Mr.
Thank
Shiva
you.
and Mr. P. Really
Thank you.
appreciate. Thank you. Just
Thank
I'm
you.
representing all of them, so we really appreciate. And thank you
Okay,
so much for
that's
valuable
nice.
time to give us and your attention, your time, your preparation is wonderful. So very nice presentation, the slides, everything. Thanks so much.
Okay, that's nice. That's nice, Kimia. I'm happy, but only thing is what I found, we had less time, so we had to, concise everything. Actually, if I take basics of oncology, I could just take 2 products. But basics of oncology itself takes at least 1 day, and then you can understand the products even in a much better way. But we had to, concise the whole lot of it with just 2 topics. And even products we have taken in brief. We have just restricted our discussion to mode of action, indication, and few protocols. You know, otherwise we take a very detailed program, but since we're short of time, so we could do this. But wherever in future you all require a detailed training, we are open to it. And only thing is, I have requested Osama, please tell us in advance, right? So then
All right.
we'll be prepared, right? Yeah.
Sure. Thank you
Okay
very
then.
much.
Yeah, Shiva, you can
Uh,
also share your views. Yeah.
no, I think you have shared everything, I think. So I hope you have liked my presentations and and we can understand what I have explained.
And in
Okay.
fact, I would say the audience were really good. You all have responded
Yes,
and reciprocated
responded very
quite
well
well. So good. Your participation was good.
too.
Good,
Yeah,
Mostly,
good.
sure.
especially the Rosa one. She is very participated.
Yeah. Okay. But I think on the first day, all of them came out and could
Yes,
express.
yes.
So that was very nice. Very nice. Because otherwise, having a virtual training is very difficult because you cannot make out whether the other person is understanding or not. But you have such interactions, only then you can make out that people are understanding. Right? Okay.
Awesome. Awesome. I saw him when he passed, so say good, they already finished. So yeah.
Who was it?
Osama, I saw him
Oh.
when he passed, so it's the right time to say thank you and goodbye.
He's coming?
Yeah, he's coming.
Okay.
Miss
Okay.
Trupti,
Yes, Osama, I can't see your face.
Shiva.
Okay, yeah,
Yes.
Osama. Yes.
Yes,
Nice
hello.
to see you. Nice to
Yes,
see you.
yes.
I hope your training was successful.
That you have to tell me.
Yes.
That you have to tell me.
Speaker
You can check with your team and tell me.
Yes.
Successful. Yes. I just confirmed that they are satisfied.
Very good. Very good. That's
So
really nice.
thank you very much for taking your time and giving us the training.
Okay. That's my pleasure. Yeah.
Yes,
So,
my best
fine.
regards to Mr. Abhay
Okay.
and
Yes,
top
yes.
management.
Okay. Thank you. I'll of course
Thank
convey
you
your
very
wishes to Abe also.
Yes.
Okay. Thank you,
Okay,
Osama.
thank you.
Thank you.
Nice time. Okay, bye.
Thank you.
Okay. Chalo, bye-bye.
Thank you.
Bye to
Bye, bye,
everyone.
bye. Bye, bye.
Bye.